This is Late Night Health and Dr. Greg Celaya. Hi, I'm Mark Allen. During the next, 15 minutes or so, we're going to talk about cardiovascular disease with functional medicine expert Dr. Greg Celaya. Dr. Celaya has degrees in nutrition as well as being a chiropractor as well. Cardiovascular disease, Dr. Celaya, is growing by leaps and bounds. Obesity, diabetes, all these things. We're getting fatter, and a lot of this is causing cardiovascular disease. Am I correct in that?
Yeah. Hey, Mark, it's good to hear from you. Yeah, we have about 800,000 deaths in the U.S. just from cardiovascular disease alone. And coronary heart disease accounts for the majority of these deaths, followed by stroke and heart failure.
And they're all related to cardiovascular disease.
Yeah, we have about 90 million Americans carry a diagnosis of cardiovascular disease.
That's almost a third of the population.
Yeah, it's crazy. Over 45% of non-Hispanic Blacks live with cardiovascular disease in the U.S.
Blood pressure, high blood pressure, is also something that many people have. It's known as the secret disease or the hidden disease because you can't normally feel it. Is that considered a cardiovascular illness as well?
You know, it leads to cardiovascular disease. And you're right. There's so many people with high blood pressure, but they just don't seem to get it. But then again, they don't seem to get diabetes. They don't get to seem to understand obesity. I don't know. It's an interesting scenario that we have going on, not only in our country, but now it's spreading worldwide, right? It's smoking worldwide is on the rise. Can you believe that?
No. Even here in the U.S.?
No, not necessarily in the U.S., but worldwide it is.
I wonder if it's the millennial generation, because you and I have talked about it when we were in our 20s, which was just about 4 or 5 years ago, that, we felt indestructible. We were invincible.
Yeah, you're right. And we have about 34% of the population has high blood pressure. That's quite a bit, right?
And is it starting younger and younger?
Well, sure. How many times do you go to a store and you see a young child that's obese? I see it all the time. And I'm just wondering to myself, hey, parents, can't you see what's going on here? Does this bother you at all? And it just doesn't seem to bother a lot of people until it's too late.
Or they don't see it. I mean, I'm going to say something that I think is kind of funny, but at the same time, it's sad. It's like an older woman or an older guy dressing as if they were still in their 20s. For example, a guy who has 18 inches of gut hanging over his belly wearing a Speedo, or a woman, wearing makeup like she did in the 70s. And they don't understand that they look, ridiculous. They look silly.
Well, everybody has the option to look how they want. But when it comes to your health, I mean, you have to take care of this body, and a lot of people aren't taking care of it. We have about 23.4 million Americans have diabetes, and 7.6 have it and don't know about it.
That's amazing.
7.6 million.
We talk about this a lot, the E word, the exercise word. Would that be one of the first things to take a look at to prevent cardiovascular illness?
Absolutely. It's 1 in 3 Americans don't meet. Oh, the Google thing went off. Sorry about that. Anyway, 1 in 3 U.S. adults don't meet the current recommendations for exercise.
Wow. Do you remember?
Hey, listen, my Google Home heard it and is giving me all the stats. How funny is that?
Oh, yeah?
Yeah.
You heard the phone ring?
No, it heard me talking about diabetes. The next thing you know, I don't know, maybe I mentioned something and it started giving me statistics.
Did it really?
Yeah.
That's way cool.
That's funny.
When we were in high school, there was the President's Fitness Council. Now, frankly, I could never climb the rope. I just couldn't. I did it, I think, once in high school. And you had to climb a rope, you had to do a certain number of sit ups, push ups. Do we have those requirements anymore? Do you know?
I don't know if we do. We probably don't, just from the fact that maybe we don't want to hurt somebody's feelings because they can't do something. I don't know. But I think it's a real problem. And in addition to that, you start looking at how we're testing for cardiovascular disease nowadays. It's the same as it was in the 70s, and we're using 1970s technology. At least most doctors are. I'm not. I'm using state of the art, today technology for testing. And it's extremely important to do so. So exercise is part of it. Not smoking is part of it. Eating the right foods is part of it.
And let's talk about the testing. Is that blood test primarily?
Yeah, primarily blood testing.
And what about other kinds of testing that you do in your office?
Well, we like to rely on a lot of blood testing because it gives me some great answers. And you can't cheat a blood test. Well, sometimes you can, but some of the tests we can't. And it's great because we get to see really what's happening. It's so frequently I'm seeing a patient that's coming in and says, I'm going to go on statin medication because I have a cholesterol problem. Well, the problem's not cholesterol. 50% of the people in the hospital that have had heart attacks have normal cholesterol. Cholesterol's not the issue.
Or what's considered normal cholesterol.
Right. I mean, your body makes cholesterol whether you eat it or not. Every cell, every hormone, everything is in your body is made of cholesterol and fat. And we've gotten to a point where we eliminate the fat because we think fat is making us fat. And we think cholesterol is giving us heart disease. And it's not. There's so much more to it, Mark. It's you can't go by the old stuff anymore. It just doesn't work.
Right. And some fat, especially the good fats like vegetable oils, organic vegetable oils like olive oil, would be a good addition to a diet?
Well, certain oils, vegetable oils, usually not. Usually they're not good for you because they can oxidize, which creates inflammation.
What about olive oil?
Olive oil is great. Olive oil is great. You shouldn't cook with olive oil because it does oxidize once it starts to smoke, which is about 150 degrees. So you want to try and stay away with cooking with olive oil, but you can use it on salads and other foods. I eat a lot of olive oil. But when you start looking around at food products, you see this canola oil in everything. And even if it's organic, it's still garbage.
Is it really?
Yeah, it's not good because it is a polyunsaturated fat, which oxidizes and creates inflammation in your body.
And inflammation, as you and I have said, is the root cause of many illnesses.
It is. It is the root cause of so many diseases, and oxidation is one of them. And we have to be careful in the fats. And you still see trans fats out there in all these processed foods, and even though it might be getting a little bit less, I don't think people really care or know until it's too late.
Is it ever too late?
Well, when you're dead, it's too late.
Yeah. Right.
Or if you're having to undergo a heart surgery because of your lifestyle, yeah, it's still not too late, but gee, you think you might have gotten the hint a little bit earlier in life.
You've seen The Biggest Loser, I'm sure.
Yeah.
The TV program. I'm always interested in seeing these very heavy people, these obese people, weighing 300 plus pounds, being 5'8", 5'10", and weighing 350, 380 or more. And also, you hear every now and then about somebody who's stuck in their apartment or townhouse on the 28th floor, and they need a crane to get them down so they can go to the hospital.
Yeah, and you hear that. But you know what? When somebody's looking for help, thank goodness, right? But it seems as though we need to start looking for help earlier, and we need to start doing the right testing. we have to look for triglycerides and insulin level and cortisol levels and testosterone levels. And I mean, the list goes on, inflammatory levels and the density of the different particles like LDL, HDL, IDL, VLDL. All those are so important to make sure we understand so we can minimize cardiovascular disease in the future and what we can do about it now, because there is so much we can do about it now. And it doesn't have to be medication, because the medications aren't fixing anything. They're just treating the symptom, right?
Right. They're masking the problem.
Yeah. Yeah. It's, if you look at the cut sheet that comes with a lot of these statin medications, and they say they're meant for temporary use while lifestyle changes are performed. And in addition to that, they say that they're meant for people with familiar hyperlipidemia, which is a genetic trait. And usually that happens in about 1 in 500 people. And if that's the case, why are these statin medications the top prescribed medications? It doesn't add up. The numbers don't add.
Let's talk about exercise in our remaining few minutes here, and that is, you told me once, and I'm hoping that that my information is still up to date. You were telling me that one of the best exercises, cardiovascular exercises, would be sprints.
Yeah, exactly. The sprints or the burst training is better for you because it doesn't increase the oxidative stress in your body. So you're not necessarily using oxygen for exercise, for the energy. You're using different things, and it minimizes how much oxidative stress, which creates inflammation. So you've seen these people that are doing long runs like the marathons and the guys doing Tour de France.
Right.
It's so hard on their body. Now, amen to both of them, but it does create additional stress in your system, which can create inflammation and hence more disease. So you've got to be careful. And so many people don't practice moderation. And that's part of it as well, especially with exercise. Either they don't do anything or they go nuts and they're doing way too much.
So if I were to go to the local park and start on Monday, this is Tuesday that we're recording this, by the way, so I have a whole week of non-exercise. But if I were to go on Monday and sprint, you go a minute or as long as you can, and then take a minute break and run back and then keep doing that? Is that the idea?
Yeah, if you're healthy enough to do so, I mean, because that's part of it. You don't want to be 350 pounds and start doing heavy sprints because you're going to break something.
Right.
But sprints can
be always, before you change or add any regime, you should check with your healthcare professional.
Oh, absolutely. And you may want to start slow. But if you're getting into sprints or burst training, it could be anywhere from 15 to 30 seconds of exercise, and then take time off and then do it again. And you may do it anywhere from 3 to 6 times. And the thing is, it doesn't take long.
And is it a quick way of dropping those unhealthy cortisol-filled tummies?
Well, it's going to help. If your diet's bad, all the exercise in the world isn't going to reduce your inflammation. In fact, it may increase your inflammation. So cardiovascular disease, just like anything else, everything contributes to everything. So I see it so often. People come in and they say, yeah, I smoke, but I exercise a lot, and so I must be okay. And it's like, no, that's not the case, right? It's everything.
I just interviewed a doctor on Late Night Health whose mom died of stage 4 lung cancer. And, I didn't have to ask if she was a smoker.
Yeah. And I mean, it's not like the information's not out there, but the problem is you have an addictive thing, just like food can become addictive for some people as well. And I feel for them, right? And I feel for the smokers, but you have to really put priorities in place and do what you have to do to make it happen. So, you go back to the Biggest Loser, like you mentioned. Hey, my hat's off to those people, because not only are they doing it, but they're doing it on television. They're for everybody to see. And so my hat's off to them. They're doing something. And the problem is most people don't do anything. First off, their doctors don't tell them to do anything. I had a patient just the other day, had really bad levels of cardiovascular disease on my testing. But they had it done by another doctor. They had just had basics done by their doctor. And their doctor just said, hey, let's go ahead and just do the statins, and we're going to put you on blood sugar medication because their blood sugar was really high. They didn't look or even suggest diet or exercise. They just said, take the pills. Now, probably they did it because they understand that patient compliance probably isn't going to be that good. And so they'd rather, they'd rather give them something other than nothing. But so this patient came to me and he says, I don't get it. My doctor didn't really talk about any of this stuff. But we changed his diet and his blood sugar changed almost overnight. Not to mention, we're doing testing, more advanced testing for cardiovascular disease to see where he's at.
Well, that's the phone, and that means we're out of time for this segment. I should have mentioned to everybody that we would love to have you go to Dr. Celaya, that's DrCelaya.com, subscribe, and there's a little notification. And every time Dr. Celaya and I talk, you'll get a notification that, hey, we're around, we're up, we have a brand new video for you to take a look at. You can also go to latenighthealth.com, latenighthealth.com, for additional information and to see the videos as well. And on Late Night, we'll also have those posted on Facebook as well as LinkedIn. Dr. Celaya, anything else in your final comments here?
With YouTube, you can go down and subscribe and also hit that bell button so you're notified that way as well. But no, it's cardiovascular disease is a big deal. I love working with cardiovascular disease because when I have a compliant patient, the results are phenomenal. And they can have great results. They have to be compliant. They have to want to change. But you can go to my website and get a free 15-minute consultation, and we can talk about it. There's so many things that you can do, and there's so much health that you can obtain. You just have to know what to do. And unfortunately, the medications aren't going to fix your problem.
Right. Well, visit Dr. Celaya at drcelaya.com, and you get a free 15-minute consultation. You'll do that over the phone and even over the internet?
Yeah, either phone or Skype or whatever. Usually phone works pretty well with that. So absolutely.
Got it. We will see you next time, Dr. Celaya.
Thanks, Mark. It's good to be with you today.
You too. Thank you, everybody. We'll see you next time.